Welcome to the online pain education session, Information for Patients Having Injections. My name is Dr. Tom Dawes, and over the next 14 minutes, I will be taking you through this education session. Why is this presentation so important? We all want you to get the best out of your treatment, and this presentation allows us to teach you how we believe you can. However, we often hear a common misplaced belief. As a pain specialist, you're here to cure me of my pain. But the reality is that greater than 90% of patients with persistent pain will not be free of pain in the long term. If the pain has been present for longer than 2 years, this rises to over 99%. Our job is to maximize your function and quality of life despite your persistent pain. Let's try looking at persistent pain from a new viewpoint, starting here. Do you think these Paralympians' disabilities will go away? Let's think about this. Paralympians have permanent disabilities. They improve physical function despite their disabilities, which is why they are Paralympians. Their disabilities do not go away despite their amazing physical function. But they will not compete against Olympians because their physical function will not be the same as a non-Paralympian. Okay, is this not just about my injection and making my pain go away? I'm afraid not. All medicines are temporary, whether swallowed or injected. This is about what to do with the benefits whilst it is working. So what is it about? Lance Armstrong can help illustrate a key concept. So why do we look to Lance Armstrong for inspiration? Over many years, he trained his body to improve his physical function, winning 7 Tour de France races. But we now know he used drugs orally and injected, and so cheating. But was it just because of the drugs he won? Or was it because they allowed him to train longer and harder? If he used drugs without training, do you think he would have won all those races? And so pain management is the same. The only thing that improves physical function is physical activity. Athletes train, whereas patients rehabilitate. But the principles are identical. Manageable amounts more often will accumulate a greater total. If a treatment makes you slightly more comfortable, it will be easier to rehabilitate. Just like when Lance Armstrong took drugs to help him train harder and longer. So what does this look like for me? The short version is stretch as often as possible to counter stiffness, and pace all physical activities to prevent pain flares. So why stretch? Pain tells muscles inserting into or overlying an area of pain to tighten up. Constant pain constantly tells muscles to tighten, for example, to stiffen if you stay still. Gentle movement loosens stiff muscles, just like if you get cramp. But you should do this within your limits and borders. This is our way of saying the stiffer you are, the smaller you stretch. Think basic cramp again. Small movements to start. As it loosens, you increase the range of movement. But how often is enough? This depends how quickly you are stiffening up. Don't overdo it, so causing a pain flare, as more pain just causes more stiffening and faster stiffening. Quite simply, the more often the better. but keep it simple and start small and turn it into a habit. Simplicity is king. All movements stretch the opposite side, whether sitting, standing, or lying. These pictures show a variation on a theme. Which of the two twists could you do in a busy waiting room? Habit means as often as possible. You could be sitting watching TV, do some stretches, or stood waiting for the kettle to boil, do some stretches, or lying in bed and can't sleep, do some stretches. So what's the benefit of habit versus traditional sets? In a traditional set, you may do 40 stretches 3 times per day, but 40 in one go may hurt. And you need 10 minutes to do the routine, so have to squeeze it into a busy daily routine. This is inconvenient and so less likely to happen. Overall, you may achieve 120 per day if you can cope. Habitual is handfuls here and there. It's convenient as it is in and around your routine. It can add up to maybe 50 to 60 over an hour, but spread out so it doesn't hurt. It can lead to far more than 120 per day. Pacing is another important concept to use. So what does this mean? Athletes train hard, but they mustn't overtrain or else they only go backwards. Patients must try to stay active within their capabilities, but if they overdo it, they flare pain and go backwards. Whether athlete or patient, the more you get it wrong, the more you can go backwards. Boom and bust cycling is what happens if you don't pace, and it looks like this. If you overdo it and flare pain, you then end up having to have prolonged rest to recover. The more you boom and bust, the less you can do over time, and in fact, you end up deconditioning. So how do you pace? It's little but more often. For example, to move a ton of sand, you don't drag the entire delivery sack. You use a wheelbarrow to go back and forth multiple times. It's the same principle here. 20 plates of washing up done in one go or 4 lots of 5 is the same. You're more likely to cope with the second method, and then you can start the next task. It's just like the habitual stretching. The trick to not boom and bust? Don't push to get through the pain barrier. If 10 minutes or 10 repetitions risks crashing through your pain barrier, try to stop at less than 10. The pain barrier is a crash barrier. Do you expect this car to work as well or worse after hitting the crash barrier? So again, the trick to pacing is small amounts that do not aggravate pain levels and done more often. Circulate between different activities to use different movements and muscles. Think about it. Why would you rotate between different exercises? Because you fatigue if you keep going until finally you just can't keep going. Why circulate? In the end, you average more. Training or rehab is about accumulation. You can't cram it all into too short a time period, or you will bust. If you average more in the long term, you will be fitter and stronger, gaining more physical function. We frequently hear about physiotherapy. The physio hurt me, so I didn't go back. I tried it, but it didn't make any difference. It doesn't help my pain. I couldn't manage the exercises. So what's our response to some of these common situations? While physiotherapy hurt me, physiotherapists may have time pressures to try and get through things, filling the time efficiently, but this may risk not pacing appropriately. They may think asking you to do 10 repetitions is gentle, but it might be too much for you right now. So you could tell them, my body says 6 at the moment, but I can do 6 2 or 3 times throughout the day. If physiotherapy made no difference, 6 to 10 sessions is likely to make little difference. However, Andy Murray was still a novice after 10 tennis lessons. But you can practice what they have shown you and keep doing it as often as possible. And back to Andy Murray, he learned things from his coach, but in a match he then practiced what he had learned. Physiotherapy does not help my pain. The primary goal is functional improvement, and it's not curing pain. Remember that training for athletes is rehab for patients. Saying that, it can reduce pain in certain situations, such as easing stiffened, spasming muscles, or in a new prolapse disc where rehab can promote healing. Or I can't do those exercises. But remember, there are variations of the same exercise, be that sitting, standing, or lying. We often hear the question of will you get repeat injections to control your pain? Well, only if they are helpful. If a tablet doesn't work, we don't re-prescribe the same tablet, and only at safe intervals. Too often can lead to cumulative harm, just like with tablets. So what do you do in between the injections? Exactly the same, but scale back slightly when pain levels are higher. View injections as a window of opportunity. Whilst it is working with reduced pain, take advantage to build and take 2 steps forward. When pain returns, you will have to scale back and hopefully only 1 step backwards, as you will have gained more function whilst the injection was working. What are the effects of treatment on pacing? This graph shows that the injection done at time point 2 has allowed functioning to improve from 8 to 12. Then the injection wears off by time point 6, but you are now stronger and so have the new baseline functioning level of 10. A repeat injection at time point 9 allows again 2 steps forward, then 1 back as it wears off, but again you are at a higher overall level of functioning. So injections are a window of opportunity to build and increase your level of functioning. So in summary, managing any pain condition is about the physical rehabilitation, which involves stretching and pacing, and treatments, including injections, to allow better physical rehabilitation. Injections aim to open a window of opportunity to improve baseline physical function before they wear off. Here are 2 useful websites that you may find information that can help you live alongside your pain well. Thank you for listening.